Hey, thank you for joining us and welcome to this year's TRSA 2023 Legislative Conference Preview. I appreciate that you have registered to come be a voice for the industry. We have a lot of issues to talk about. So thank you for making the effort to join us here in Washington, D.C. The first thing we'll do is we'll go over the schedule. We've actually extended the day or extended the conference a little bit because we've added supplier partner workshop to allow our supplier partners to come in a day early, and we have a program for them. And that kicks off at 2 o'clock on Tuesday, March 21st. Registration for the entire event will open at 12 noon on Tuesday, and the event will run through March 23rd, Thursday, March 23rd, culminating with our congressional visits. On Wednesday, March 22nd is when we do a lot of the association business. Registration opens at 10. There will be a lunch available at 11:30. And then at 12 o'clock, we will have our first set of committee meetings. And then 2 o'clock, we'll have our second set. This is not 4 hours of committee meetings. It's 2 blocks of committees. You will be receiving your schedule for your committees when you get the final confirmation here in a couple of days. Then at 4:15, we'll have a welcome and our keynote speaker, Bob Cusack, who is a political insider on Capitol Hill. He'll be talking about what's going on, what to expect when you go to Capitol Hill, some of the issues of the day, and looking forward for the rest of the year. We've also added a level of to the legislative conference for a spouse guest program. And so the spouse guest program will kick off at 4:30 on Wednesday with a meet and greet. Then after our keynote speaker, and then there will be another issue brief that will go over what we're going with today. We will then have our industry awards reception at 5:45. Where we have a legislative of the year guest, Representative Troy Balderson from Ohio, who will be joining us, and we're excited about that. Mr. Balderson's been working with us to try and increase the number of reusable healthcare textiles in the healthcare facilities. He's working closely with Representative Richard Hudson, who we'll talk about here in a little bit. And then Wednesday will culminate with our industry awards dinner. If you've been to these before, you know how fun they are. We have a lot of awards to hand out, service awards, best plant awards. And it's a lot of fun to be a part of. So that will end our Wednesday afternoon or evening. And then the real fun begins Thursday, March 23rd, when we actually take the issues that you've learned about over the last couple of days and in this presentation, and then go to Capitol Hill, where you'll be meeting with members of Congress. So the registration will open at 7. We are having breakfast on or at the Capitol or on Capitol Hill at the Capitol Hill Club. We will have buses leaving the hotel approximately 7:30. We'll make sure that you have the exact time for that when you arrive on site. And then the breakfast will start about 8. We have 8 to 9 on here, because that'll take us into congressional visits. So we'll have the room, and you can hang out there until your first set of congressional meetings. And then you can go to those meetings, whether it's on the House side, because we're going to be on the House side, or on the Senate side. And then the room that we will have the breakfast in, we're going to stay in all day, and it's going to be sort of a meeting place for you to camp out, depending upon how long between break time you have in your meetings. We have extended the day. Time was we would end at 12, but that didn't do us very many favors trying to schedule meetings. The fact that we are going most of the day or all day is meant to increase the amount of meetings that we get scheduled. There will also be a lunch. It will be in the room at the Capitol Hill Club that we have breakfast in. It'll be an all-day lunch, so to speak. So if you have some meeting times that are bunched together, don't worry, you'll be able to make it back, and we're going to feed you. You're going to keep your strength up for all these congressional visits, so for all the advocating that you're going to be doing on behalf of the industry. So At this point in time, we are still in the process of getting meetings scheduled. On Thursday, March 16th, which is Thursday of this week, you should be receiving an email from Advocacy and Associates. Advocacy and Associates, it's the group that's scheduling our meetings, but they will be sending you your login information and the website for you to get your meetings. So on Thursday, if you have not received your meetings or an email to go through your meetings by Thursday afternoon, check your spam or your junk mail. So be ready, and then be ready to go to the Hill. They will have a tutorial on how you can look at your scheduled meetings, and they'll also have some opportunities for you to do some backgrounds. So be on the lookout for an email from Advocacy and Associates on Thursday about your meetings. Now let's get to the meat of the order. For many of you, you've probably done this many times before. You know this, but if this is your first time, know that when you go into a Hill staff, some of you are going to have the opportunity to meet with the actual member of Congress. The majority of us are going to be meeting with staff. When you see these staff, they're going to look, well, they're not going to look young. They're going to be very young. So don't be surprised if you walk into an office and you see something like this. Don't be taken aback. They have a lot to offer in a meeting, and they will actually be our voice to the member of Congress that you visit. When you have your meeting, here's some things that you need to come do some homework and talk about. Be able, not only the issues, but talk about who you are. Talk about the company you work for in your company. How old is the company? How many people are employed by your company, or if you're the owner, how many people do you employ? How big is the plant? Do you have a new plant? Is it highly efficient? Is there something interesting about your plant? What types of charitable organizations and functions do you do back in the district? All this is to give them a picture of who the industry is and what we are, and also an opportunity to find some sort of common ground, something to get their interest more than just about the company, but about what you do for the community and ultimately for their constituents. There are two main topics of conversation we plan on hitting this week or next week. And they're going to be very familiar to you because they've been for the last couple of years, but we've actually been starting to make some headway, and we're starting to get some forward motion, and we just got to keep it going. But one has to do with improving and protecting the supply chain, more specifically in the healthcare contact textile realm. We know that there's too many disposables in the market. We're trying to increase the number of reusables in the market. And then also improve public safety by requiring healthcare facilities to launder and supply to hospital staff clean scrubs and uniforms. There very well may be a third issue. We're waiting on the final approval for the board for some language. But if you're not in the healthcare realm, there's going to be another issue that we will probably talk about, which is PFAS, and that covers all industry sectors. At this point in time, we do not have any final language to offer on the issue brief, so I'm going to leave it off for now, but we'll take care of that next week if we in fact reach approval of what we're trying to accomplish with PFAS. So the healthcare supply chain, I just briefly touched on it. Healthcare facilities have an overabundance of reliance on disposable goods, especially in the healthcare contact market. Barrier gowns, other types of scrubs and patient gowns. As a matter of fact, we estimate 90% of the uses in healthcare facilities are disposable. And we're getting information here just recently that is proving that 90% still holds true. And part of the problem with this over reliance on disposables is it leads to supply chain issues and healthcare worker safety issues. We all remember, and this is something that you should bring up in your meetings, is all the pictures that we saw during the height of the pandemic of healthcare workers wearing trash bags and dish gloves and breathing through scuba gear when they're seeing patients. Well, we could have alleviated all that if there would have been a share of disposable with reusable contact textiles. Just to put it in perspective, one reusable garment takes the place of 75 single-use disposable gowns. And these are all numbers that the staff needs to hear. Most specifically, when a disposable gown is used the one time, it then goes to the landfill and all of a sudden is medical waste. The reusable gown goes back, gets cleaned and comes back. And like I said, it takes 75 single-use gowns to make up just one reusable. So what exactly are we asking for with this information? Well, we have a letter that you're going to have in a folder that is a letter for a member of Congress to sign to Secretary Javier Becerra, the Secretary of Health and Human Services. And it's ways for him to use to increase the use of reusable healthcare textiles in hospital and healthcare facilities. Help reduce waste and increase the efficiency and the supply chain of these goods. Also, we're asking the people you're talking with, whether, and both of these have to do with whether they're a member of the Senate or a member of the House. They can sign the letter for Secretary Becerra, but also to contact Representative Hudson and Representative Eshoo. It's a bipartisan leadership working on a bill called the Pandemic and All Hazards Preparedness Act. You're going to hear me start using the term PAPA. So we're asking that we get some language in PAPA that requires healthcare facilities to increase and have a threshold, 50% threshold of healthcare, of reusable healthcare goods and garments in their inventory, so we don't have to see those trash bags anymore. The second ask also has to do with the healthcare realm. It has to do with the industrial laundering of scrubs and uniforms. You've heard us mention here at TRSA multiple times, and we're going to keep talking about it because the study is still going on, that we, along with some of our European partners, entered into a study with the Montfort University about how long a virus stays active when it comes in contact with a healthcare textile. Well, the study shows that it can stay active anywhere from 24 to 72 hours, depending upon the makeup of the textiles, whether it's all polyester, all cotton, or some hybrid in between. But it stays active anywhere from 24 to 72 hours, meaning it can infect someone that comes in contact with it. So if you're standing in line grabbing a sandwich somewhere and you're standing next to someone in scrubs and they happen to have an active virus on it, if you were to brush up against them somehow by accident, all of a sudden you can then have that active virus on you. The study that we're talking about does show that the industrial laundering process does kill the virus. So what we're asking is for healthcare facilities to provide fresh, hygienically clean, laundered scrubs and uniforms for healthcare personnel. And I don't mean just the direct workers as far as nurses and doctors, but for the environmental services folks. Anybody that would come in contact with a virus should have clean scrubs when they start work, and then change and get back into their street clothes and put the scrubs and uniforms in a bag to be handled by someone who knows how to handle it. Also, the ask is similar to the previous issue. It has to do with contacting Representative Richard Hudson and Ms. Eshoo to add language in PAPA to address the safety of healthcare scrubs and uniforms by requiring healthcare facilities to provide fresh, hygienically cleaned, laundered scrubs when the workers come in. We also have studies that show that the healthcare workers might not even wash their scrubs and uniforms after every usage. They might use them several times before they wash them at all. And so that's why it's so important about getting this in the language of the Preparedness Act, reauthorization. So right now, those are the two issues we'll be talking about. I do believe there's going to be one more that has to do with PFAS and looking for grants on studies to filter PFAS out of wastewater, but we're waiting on final language for that right now. So when you're in these meetings and you talk about the issues we just discussed, how do you close? Well, it's similar to whenever you're trying to close a sale in your business. Ask for a commitment. Well, will the representative or the senator that you're meeting with, will they be able to sign the letter to Secretary Becerra? Ask for them for a commitment. If they say, well, I don't know, I'll get back to you. Well, then it's a good opportunity to follow up after you leave. But ask for the close. Will they sign a letter to Secretary Becerra? Will they contact Mr. Hudson, and if they're Democrat, Ms. Eshoo? So make sure that you end with an ask. And also, we're not expecting you to be experts on any of this information. Some of you will be, but if you're not an expert about this and you are asked a question you don't know the answer to, there's nothing wrong with saying, I don't know, but you will get back to them. So, it's perfectly reasonable to say, I don't know, I'll get back to you with that answer. Just make sure that if that is an answer, you get back to me and let me know that so I can follow up with that member. There were a few last year that we had these issues with, and we ended up making a good contact in these offices because I followed up with them and we ended up having good conversations. So close with a commitment, and don't be afraid to just say, I don't know the answer, I'll get back to you. And then here's something that you don't do. Do not make an offhanded joke about or comment about the well-being of a legislator or staffer. Now, I actually have a specific issue or instance where I was involved in a meeting or with a group of people, and somebody happened to pop off and make a comment about a senator in a senator's office, and that did not go well the rest of the day for that the person that made that. And that was 14 years ago, 15 years ago. With today's hypersensitivity to threats on Capitol Hill, it's really not a good idea. Even if you're making a joke or something might strike you funny, don't make it and don't say anything. And one other thing, do not make any comments about money, nothing about fundraising or how's the campaign going. Don't make any comments about money, because if you do that, then that all of a sudden your meeting's going to end, and all the work that you're doing and the relationship you're trying to build, that will go away. But most importantly, have fun. This is a good time. I get a charge out of this. This is what I enjoy doing. This is why I'm glad doing it for you. And I'm doing it for this industry because it is so much fun. And I think anyone who does this and has done it before would agree how enjoyable it is to be able to go up and advocate and exert your right as a citizen to work in the citizen's house. So I appreciate your time. If you have any questions, this is my information. Please do not hesitate to use it. It has my email, my cell phone. Most importantly, if you do not receive an email from Advocacy and Associates by the end of by the end of Thursday, let me know so we can make sure that you can get your meetings, your schedule for next week. Some of those meetings will probably still be questionable. We're not going to have meetings nailed down until Tuesday or Monday or Tuesday of next week. So don't be worried. You'll get a meeting. We just won't know what the time is. So with that, I appreciate your time. Again, thank you for taking the time out of your busy schedule to come advocate on behalf of the industry, come be a lobbyist for a day, and come enjoy and honor the award winners at our awards dinner on Wednesday. With that, I look forward to seeing you, and I hope you have a fantastic day. Thank you.